All right, thank you everyone. My name is Sunny Mullen. I am the Outreach Manager for Help Hope Live. We are a national nonprofit that assists individuals living with catastrophic illnesses and catastrophic injuries to go into their communities and fundraise for their unmet medical expenses and related costs. So thank you all for joining us today. We are joined today for our Hope Talk on COVID-19 and the paralysis community by Dr. Linda Schultz, or Nurse Linda, as most of us know her by. Nurse Linda is a leader and provider of physical rehabilitation nursing. As a PhD, prepared nurse, and researcher, her experiences include patient care from the time of injury or diagnosis through intensive and acute care, rehabilitation, and home living. Dr. Schultz collaborates with various healthcare institutions and organizations providing expertise for research and quality improvement projects, especially for individuals with differing abilities. Nurse Linda, we're so happy to have you here. I'm going to pass the mic off to you, the Zoom, so to say. Turn my camera off because everyone is really here to listen to you. So thank you so much. The floor is yours.
Well, thank you, Sunny, and thank you so much for having me today. I'm delighted to be Zooming with you, and it's wonderful to be here with Help Hope Live. So this is a great organization, so thank you so much for having me on. So with this COVID thing, it's kind of an interesting thing because I got started with COVID. Somebody asked me, could you write some information about adapting the CDC guidelines for individuals who are perhaps using wheelchairs or other devices, have paralysis or other neurological injuries. And I thought, well, I don't know anything about the COVID, but that was back in the beginning and nobody knew anything about the COVID. So I've been lucky enough to get to follow this along, which has been an interesting process. And so now here we are, we're really into this now. A lot of people think we're coming near the end, which is a lovely thought, but now's the time when we really have to steel ourselves, really be hyper vigilant because people are kind of getting a little, we're coming out of this now. And in fact, we're on the beginning of the end of it, but we don't know how long that ending will take. So it could be several years. So hopefully not, but it could be quite a long time. So be sure and wear your mask, be sure and wash your hands for 20 seconds, scrubbing vigorously, and social distance. We have to keep doing those things. It's going to be very critical. Now, for individuals who have any kind of paralysis or differing abilities, there are maybe some extra things that you need to do. You need to do those three things no matter what. But there are some little caveats to that. For instance, wearing a mask. There are some groups of people that should not be wearing masks. One is people who are under age 2. They shouldn't be wearing masks at all. People who have difficulty using their hands should not be wearing masks. And people who have severe breathing problems where a mask would impede their breathing should not be wearing masks. Now, if you fall in any of those categories, you need to stay out of the social grouping at all and really isolate yourself because you won't have that mask protection. The reason for that is sometimes when people breathe into their mask, very rarely, but sometimes what can happen is the carbon dioxide that you breathe out builds up inside that covering over your face. If you get that carbon dioxide building up, what will happen to you is you'll get a little sleepy and you'll kind of fall asleep, but you keep breathing the carbon dioxide, it keeps building up in the mask. So if you can't use your hand to take it off, if you're a small child, if you're under 2, somebody might be thinking, well, they're kind of tired, so they're taking a nap when they're really having this problem. Now, especially for people who have breathing problems, if you're on a ventilator, you should not be wearing a mask at all. If you have difficulty breathing or breathing issues, so maybe asthma or, any of a host of respiratory complications, especially now they're saying that double masking is good. So be careful how you do that. Sometimes people do so much masking on their face that they're really occluding their ability to breathe in. So what I like to do is to take a mask and then put in what really is really very nice is a coffee filter, to fold it up and put it inside your mask and then put your mask on. It's a little bit more convenient. And it doesn't really stifle the air that much from getting in, but you do have to breathe in harder because now you're breathing through several more layers of material or tissue or whatever. So be careful what you line your mask with. You don't want to use things like paper towel or toilet paper. You'll notice those have a lot of fiber in them. So you don't want to be breathing that fiber in your lungs, but something that's pressed paper, like a coffee filter. You know what else is really good are really cheap napkins from fast food places. You'll notice that if you have a napkin from a fast food place, it's really pressed paper more than kind of woven paper. So if you try to wipe your hands, if you get the grease from the fast food on your hands, you try to wipe your hands, you'll see it's just a big glob of grease on there because they're really not very absorbent, but those are very good because they don't have a lot of fiber. So if you go to a fast food, ask for some extra napkins, you can line your mask. But be careful if you're feeling like you're not breathing well, if you feel like you can't get your breath, if your mask is pulling in so much that you can't breathe, rip that thing off and get some breath because we need air to breathe. Try to do it in a safe place. Another thing is washing our hands. Well, yes, we all do that, but if you're using assistive devices, especially like a wheelchair, where you'll be touching the rims and as you're rolling along, they're close to the ground. Well, you know, the COVID virus flows on the air, but gravity brings everything down eventually. So those wheels are going to be, you know, picking up dirt from just, you know, general life of rolling around in the outside, and that can get on your hands. So you want to wipe your rims as often as possible. And remember that if you are seated, when you're being mobile, if you're in a wheelchair, you're below the level of everybody else. So those respiratory droplets are going to be raining down on you. So you'll want to maybe wash your face, take a washcloth and rinse your eyes, you know, just your eyelids. So keeping yourself as safe as possible, that's going to be the key. Another thing that I always like to point out, I point out to everybody. So I speak to a lot of groups of people that don't have health issues and people that do have some health concerns. And so what I like to say is that COVID virus, as we know, it's more of a respiratory virus. It likes to enter through the nose and mouth. It can also enter through the eyes. What the virus likes to attack is something that's a particular kind of cell called the ACE cells. Those line mucous membranes. So if you think about your eyes are moist, your nose is moist inside, your mouth is definitely moist inside. Those are mucous membranes, and that's what the COVID loves. It thrives on that. Now, it can get in through a cut on your hand. It can get in other ways in your body, but those mucous membranes, what it likes. Now, you also have openings in your head at your ears, but that's not a mucous membrane until it gets way down in there. So it's pretty hard for the COVID to get in through the ears because the earwax is always pushing things out of your ears. But where else are there mucous membranes in the body? And that's in the genitalia and the rectum. And so there's a lot of ACE cells in those parts of our bodies as well. So I tell everybody, if at all possible, if you can avoid public restrooms, try to avoid them. Try to think about, even if you don't think about toileting, I mean, a lot of people who have paralysis have to think about that and time it out. But even if you don't think about it, try to stay out of the public restrooms, because when people eliminate, either there's splashing or there's force of urine, or there might be gas pass, and then the COVID gets into the air. And so when you get into public bathrooms, they're contained spaces, there's not well ventilation, there's not a lot of circulation. So there's generally a higher percentage of COVID flying around in the bathrooms. Now, one of the ways that they found to test communities or groups of people is in use for individuals. They still have the nasal swabs and the blood tests. But one of the ways that they're finding is in surveillance of how COVID is spreading is they check the wastewater. So they go into sewers, they go into sewer treatment plants. And if they notice there's a pipe coming from a certain part of town or something's going on, that the COVID virus has is coming through the wastewater in higher amounts, they know that they've got a problem area to quarantine or to do more things with. So what people often don't think about is toileting, and that being the mucous membrane as well. So try to stay out of the bathroom. Now, if you have to go, you have to go. And that's just the way that's just the nature of the thing. But if you're going to go to the doctor's office, go to the bathroom before you go. Don't wait till you get there to go. So just as your mom taught you when you were a little kid, go potty before you leave the house. Well, everybody needs to go potty before they leave the house. Try to avoid those public bathrooms. Those are danger spots that aren't often talked about. Now we have this vaccine, and this is very exciting that we have 2 vaccines. I know that they are difficult to get, and people are anxious to get it because that's our hope, right? The vaccine is our hope. So it can be I know I have just been in agony waiting to get my vaccine. And so, it's managed differently all around the country. It's managed differently in different cities. It's managed different in different counties, leastwise states, and everything. So the CDC has guidelines on how the vaccine should be distributed. And so the first group that has been released are healthcare professionals and people in long-term care facilities, because that is disproportionately people are affected by COVID in long-term care facilities. And healthcare workers, well, I don't think any of us would deny them having it because they're right in there with people who have it, known people. So, okay, let's get them all vaccinated. And we're doing pretty well in that department. So in many areas, not all, in my area, they've not moved on yet to the next phase. It's still working on the first phase 1A. They're still right there. This week, they're starting to do more in the community. In my area, they've combined group 1B and 1C. So they're doing those groups all together. So there's always a lot of questions from people with spinal cord injury or people with other neurological issues of, gee, can I get moved up on the list? Or how can I get my shot earlier? Do I qualify? And the answer is a gigantic yes, you qualify. You're not jumping the line. You're not cheating. You are qualifying for the shot if in group 1C. If they've rolled it together with 1B, you qualify. So 1B is basically people who are over 75, and then people, frontline workers like EMTs and police and firefighters, people who are going into crisis situations where people have COVID. Now, 1C, the third group, that's where people fit who have spinal cord injury, brain injury, if you have multiple sclerosis, if you have any kind of disease that affects the brain or spinal cord, so Parkinson's disease, really just about any neurological disease. I was asked about spina bifida. Yes, that puts you in this group. Why? Well, what most people don't know about spinal cord injury is or brain trauma is that a lot of times the autonomic nervous system is affected. Now that's the nervous system that makes things happen automatically. So autonomic is automatic function that keeps our digestion going. It keeps us breathing. It's all the things that we do in life that we don't think about, so I don't sit around and think, liver, let's work today. Or you don't sit around and think, I think I'll get my bowels moving today. It just happens automatically. So after neurological issues, a lot of times the autonomic nervous system is affected. One of the things that happens automatically in the body, we don't sit and think, blood circulate today, heart pump today. Another thing that autonomic nervous system does is it controls the immune system. So when you have neurological insult, you may have problems with your immune system. And since we don't know who does and who doesn't, we consider everybody who has a neurological injury to have a problem with their immune system. So it may be a very small, minor problem where you're not affected much, or it could be a gigantic problem. Sometimes people who have especially spinal cord injury issues, they have urinary tract infections, they have lung infections. Other people don't seem to have them, but some people seem to have them. It's probably an issue with the autonomic nervous system where either it's not recognizing a virus or bacteria in your body, or else it's not responding to it fast enough to get it under control, or it's not responding at all. So we don't know who's in those groups, but we know that there are issues. So right away you qualify in that group. That's, I think 1C is 65 years and older, or anyone 16 years and above who has immunity problems. So you can check that box for immunity. You have a high risk factor, you are eligible. Another thing with some neurological problems, especially with paralysis, you might have respiratory problems. You can check that. If you have paralysis, your musculature to make you breathe is affected. You might be breathing on your own because your diaphragm works. You might be breathing on your own because the little muscles in between the ribs are working. Those pull the ribs, the lungs out this way. The diaphragm pulls the lungs down to fill air in your lungs. But anybody who has any kind of paralysis will have some weakness in their abdominal muscles. As you go down the spine, those are like the last nerves that come out. You can also tick the box that you have respiratory problems, no matter what your level of spinal cord injury is. People who have multiple sclerosis, that is considered a spinal cord injury disease because the plaques affect the spinal cord, even actually a little more than they affect the brain. So you can check that box. You might have a secondary complication such as diabetes. So you might be able to check that box. That, you would know that if you had that diagnosis or not. So feel free, you are in that. So enter yourself in the vaccine registry for your area in that way. Now, I want to talk a little bit about when you go to get your shot, because I took my mom to get her. She's 93. So she fit in the 1B group. So I took her to go get her shot. And so I was thinking about, now it's an intramuscular injection. It's with a very small needle, and the vaccine right now, we have two that are active, the Pfizer and the Moderna, which are mRNA vaccines. We're going to have another one, the Johnson & Johnson, which is a traditional vaccine. That's a one-time dose that's coming out just in a matter of days. So that's going to be a big switcheroo for us. But when I was getting my mom ready to go, I was thinking about when she goes to have her injection in her arm. And so I was looking at her shirt and seeing if we could pull it down this way, so what was the first thing you do when you go to pull down your shirt? You bring your shoulder forward, which tenses the muscle where they're going to give the vaccine. You want to have that arm relaxed where you're getting the vaccine. Any vaccine, no matter what you're doing, you get a shot in your arm, have that muscle relaxed. So we settled on a zippered jacket because it was extremely cold back then, but with a sleeveless shirt underneath. So she could just unzip her jacket, take her arm out, and then just relax her arm. So that's a good thing for no matter what kind of shot you get. Now, this shot could be given in the shoulder. It could be given in the rear end. It could be given in the thigh. Those are the site for intramuscular injection. No, it cannot be given in the stomach. There's not that much muscle there on just about anybody, if you know what I mean. But anyway, those are the three sites. Now, the CDC guidelines say to give it in the deltoid muscle, that's in the upper arm. So that's what people are going to do. If, some people have said, well, I don't have sensation in my rear end or my thigh. Could I have it there? technically you can have an intramuscular injection there, but the CDC guidelines do not specify that. So I doubt that anybody is going to give you one because now they've gone outside practice areas. So the arm is probably where you're going to get it. So be sure and dress appropriately so that you're not rotating your shoulders so you can relax that arm. Another thing is a lot of people think, oh, I'm going to have a shot and I'm really scared. Trust me, it's a little tiny needle. The needle's a little, it's probably not even an inch long, and it's a very slender needle. So it only is a little sting for just like a second and boop, it's out. What concerns me is if you have a higher level spinal cord injury, there is a chance that you could have an episode of autonomic dysreflexia if you don't have good sensation in your arm, because your body's going to report something's going on here. Now, it's such a small disruption in the system that it probably is not going to cause AD. But if you have a lot of AD, come prepared with your treatment plan because it's a possibility. I don't know of anybody who's had an AD response. I've talked to lots of people. I've not heard of any. That doesn't mean it can't happen. So, just come prepared. If you have a lot of allergies, spinal cord injury or not, and you carry an EpiPen, come prepared with your EpiPen. The chance of having an allergic reaction to the 2 vaccines that are out right now are so minuscule. The number of allergic reactions have been just practically nothing. But if you're one of those unfortunate people that happen to have one, you want to be sure and have your EpiPen with you. There is a time where you sit after you shot for 15 minutes where you can see if you have any kind of effects. So that's helpful as well. Now, also, if you have a higher level injury and you get a shot in your arm, will it trigger some spasticity? That is a problem, but there again, that will calm down as well. Again, these are really far out kind of things, but I just like to warn people because, do not read a lot of the information on the internet about these shots. There is so much wrong information out there, and people get all excited and they get very hyper about this, and they're so upset by the time they get there that of course their muscles are tense and then it's going to hurt more. Don't even bother to read that. One of the things that's going out there is, oh, I'm going to get a shot, I better take some Tylenol or I better take some medicine before I get the shot. Don't do that. One of the things that they have learned is that when you get a vaccine, what those for medications for fever reducing or for pain reducing, what they learn is that once you have that in your system and then you get the vaccine, your body's already there to fight that vaccine. It's at the ready because you have triggered it with these medications. So do not pre-medicate before you get your vaccine. You want to get as much as you possibly can out of the vaccine. So if you feel like you need to medicate afterwards, if your arm is really sore, if you move it, it will not be that sore. It'll be a little sore, you got something there. But if you keep exercising your arm and moving around, if you can't do it on your own, have somebody move it for you, and then everything will just work out. It will be fine. The first vaccine, generally people might have some tenderness area for maybe an hour or two, maybe. And even that, a lot of people don't. The second vaccine, some people, not all people, but some people get feeling like they, like they're draggy, they might feel a little feverish. That's your immune system at work. So that is a normal reaction. Why some people have it more severe than other people is unknown. But here again, the majority of people do not have that reaction. So don't go in a panic that you're going to have all this trouble, because you probably won't. And, you just have to go along with, it's a small amount of discomfort for a lifetime, and you're getting your lifetime back. So it's a good thing. Now, one of the things I like to talk about too is what you're doing to help take care of yourself during this time. I know I wanted to do something, learn something new, and my learning something new, I've learned all about COVID. So I consider that box checked. But I've been doing a lot of things, you know, because I am immunocompromised from a surgical oops. So I lost my spleen after a surgical procedure. You know, you can go to the best hospital, the best doctors, things happen in life. So, you know, we all know that things just happen. And so I have been in my house for a year, which has been kind of an interesting experience. And I've regenerated, I've learned about COVID. That's my new thing. I committed to myself that I'd come out healthier than going in. So I've been exercising, watching my diet, doing a great job there. And that's worked out for me as well. But then the other things, I've kind of recultivated some activities that I like doing. I am one of those odd people that like jigsaw puzzles. So that has been a thrill to me to have the time to do that. I've been Zooming a lot with a lot of friends. I've been reinvigorating cooking for health. And so, you know, just doing a lot of things. I like to go on the computer to different museums around the world. Since I can't go see them, I like to go see what they have going on. So there again, I would just like to hear, we'll come back to it at the end if you want to type in what you've been doing. It would be great to hear, especially if how you've added activity into your life. I would love to hear those tips. I will pick up some for myself. So with that, I know there's a lot of questions, so I'll turn it to Sunny, who's got the questions.
Thank you so much, Linda. This is, I mean, you already hit so many of the questions, which is just phenomenal. So for everyone, thank you again for everyone who submitted questions ahead of time. We did get a ton, which is awesome. So we will get to as many as we can today. And as we had posted in the chat, we will certainly be putting out a blog post because Linda already has been hitting so many great points. So we will put out a blog post. And also just a reminder that we will also be emailing everyone a copy of this recording. So not to worry about that. So let's get through some of these questions right now. Let me look at the list. Here is one. I have home care providers through the VA, so there are approximately 4 individuals that are coming and going throughout the week. How often can I get COVID tested, although I'm not experiencing any symptoms of having COVID-19?
Well, now that is a great question because how often can you get it? You don't really need it. You only need to have COVID testing if you've had exposure or if you have symptoms. Now, I can understand you have people coming into your home and what are they bringing with them? I certainly get that. They're out in the world. If they are exposed to someone, that's called a primary exposure. They should get COVID testing if they have symptoms or if they've been exposed to somebody. If they have a known exposure to COVID, that's a primary exposure. If they then they shouldn't come to your house until their testing is complete and they find out that they're negative. If they come to your house and they didn't know they were exposed to COVID last night, but then they find out later and they've already been to your house, that would be them then exposing you. That's a secondary exposure. They're the primary exposure. Now you've had a secondary exposure. And usually secondary exposures, individuals are not tested. So you probably don't really need to be tested. You don't need to just be tested just on general principles. You need to have some kind of situation that would trigger the testing. So you can rest comfortably sure. Be sure those people coming in are washing their hands. Be sure they're wearing a mask when they're doing your personal care, when they're close to you. You might want them to double mask or wear a filter. You might want them to wear gloves. At the beginning of this, where we're having people change their clothes and bring clean clothes, certainly leaving their shoes at the door because perhaps they've been walking and, you know, COVID's all around. But first thing they should do, wash their hands for the 20 seconds very thoroughly and wear a mask when they're up close to you. If they have been exposed, and even if they contract COVID, wearing the mask and washing their hands should prevent it from transferring to you. But, you know, that's a risk that's a test we're not going to take. If they've been exposed, stay home.
So on that same vein of caregiving, this
Mhm.
community so desperately needs to have caregivers in the house, no matter
Yes.
what, pandemic or not. Do you have any advice on seeking out a caregiver right now? You might need to find one during this time, and you did just mention some great advice on how to have those COVID procedures, but any advice on finding a caregiver right now?
Yes, when this all first started, caregivers just were gone. They were coming to people's houses for years, and then they just stopped coming because of COVID. They felt like they needed to stay inside too. But now there's a lot more people that are out in the world. People are feeling a little more comfortable. We're all getting used to this new lifestyle. And so, when you hire a caregiver or have people come in, if you can interview them over the Zoom as a first interview, just to see if your personalities are going to get along, but be sure you have everything written out that you need them to do. So if you're hiring somebody new, you don't know them, they're, oh yeah, I stay at home and I self-isolate and I'll only be coming to your house. You might, you don't really know them. So, you might want to go back to those beginning kinds of things where you have them come, bring clean clothes in a Ziploc bag, have them go into a room in your house, change their clothes, change their shoes, maybe leave a pair of shoes at your house that's not going out in the world. And, mask up. You might want them to wear gloves if possible, but definitely washing their hands and doing all those hyper vigilant kind of things. Once you get to know somebody and you find out, yes, they are just going home and they're not, going out, boozing and cruising, as I call it, or they don't have other people in the house that are going out to work. People always think, oh, my family members won't give it to me. Well, anybody can give it to you. So yes, just be hyper vigilant.
Um, you've spoken a little bit about concerns around the paralysis community and the vaccine, but are there any special safety concerns involved with the vaccine and specifically the paralysis community? And really, one community you had mentioned about how young kids don't need to be wearing masks, but what about children with paralysis? Is there anything in particular with young children or even just children up until that 18 they reach adulthood involving the vaccine?
Well, children under age 16 are not eligible for the vaccine at all as of right now. They're testing, they're in doing clinical trials as we speak, but children are not in age under 16. You can't get it now. There's a lot of information about children don't get it as severely. Well, there's immune systems are young and healthy, and even with spinal cord injury, they're probably better because they're younger. Um, but children are very susceptible to any kind of germ or virus, just in general. They're still building up their immunities. Children can get a form of COVID that is extremely dangerous. It's a very small number of children, but we find that some children are having these multi-system infections. They're in the hospital. It's very, very serious. So you want to keep your children as isolated as possible, especially if they have immune system issues from spinal cord injury or other neurological things. You probably don't want them to be mixing with other children. Now, some people have set up their COVID pods where they have other families that they know, or they might have other children that do not have the same kind of issues that are going out in the world. So you do want to be hyper vigilant with your children. Only the children under age 2 don't get to wear the mask. But if your child has respiratory problems, again, just like the adults, they can't wear a mask. You don't want them out if they don't have the hand function to reach up and bat that mask off when they're not being able to breathe. We just have to be hyper vigilant, washing our hands, just following all the rules. So if they can't wear the mask, or you need to keep them isolated, and we need to wear the mask when we're with them.
And so with the paralysis community in general, is there any special concern with the COVID vaccine, or is it, obviously you have your everyday health concerns as it is, and then you're concerned about the vaccine on an everyday level? Is there anything that concerns the paralysis community specifically?
Well, I will say that nobody knows the answer to that, but it's looking like no. Um, but because these drugs were tested and they're well tested, we've had many people that have had these two drugs that are out, the Pfizer and the Moderna, are not your typical vaccine. They work by affecting the mRNA in your body. So what does that mean? So if you get exposed to, if you have the vaccine, what will happen when your body registers that COVID in your body, your cells will develop a little spike. It's almost like a little finger poking at that vaccine that will say, go on. So the COVID virus will not be able to enter the cells of your body. They can't get in there. If they can't enter the cells of your body, they can't replicate, they can't make you sick. So what's going to happen is they'll just pass through the body, and where are they going to come out? In the toilet. Again, those public bathrooms, I tell you, it's like, whoa. But that's what's going to happen. So the vaccine, the virus is just going to pass through you if you have the Moderna or the Pfizer. Now, they're 95% effective. So what does that mean? It means that you still have a small chance that you could still get COVID. Something could happen and the spike doesn't form in one area, but your case of COVID will be a lot less and your chance of dying will be a lot less. Out of 100 people that have COVID, only 7 of those people end up in the hospital and only 3 of those people die. And those numbers are shrinking because our numbers are going down, 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 down because everybody's following the rules. So that is a good thing. So is there something particularly about spinal cord injury? You think it's a neurological problem? How will these affect? Well, as of right now, there's no evidence that there's anything different. Could we get a great amount of people and there could be something discovered in the future? That could be. But as of right now, there's a lot of people that have had the vaccine and it has not been really any different than in the population at large. But there is a place on the CDC after you get your vaccine, it's called VSafe. So you want to go to the CDC website, type in VSafe, and you can enter information about yourself. And then they'll say what after the first vaccine, after the second vaccine, so that they'll be able to track that. It's really important with people with any kind of neurological or any kind of health condition because you can identify that and then they can look at larger groups of people and ferret all that out. Now, the new one, the Johnson & Johnson that's coming out, and it's just, it's been approved. So it's just going to be, it's got to go through the final process. So it's just going to be a matter of days. And then I think they said they have like 40 million of those vaccines. That's a one-time shot. That is a traditional type of vaccine where they take a dead virus. It's not the COVID virus. It's a virus that's similar, but it's not COVID and it's dead. So you get that, you cannot get the COVID from any of these vaccines. It is literally impossible. So they give you that and your body learns to build immunity just in the same way that it always did before. These vaccines will probably have to be given every year. Now, the vaccine does not kill the virus. The vaccines keep the virus from multiplying in your body. It either, like the Johnson & Johnson, it makes the immune system work in overdrive. We're going to get this virus. Or in the Moderna's got that poke thing, move along. But just like the polio vaccine, the measles vaccine, they don't kill the virus will always be out there in the world. Polio is out there in the world. We just happen to live in a country where we've got great water filtration systems and a lot of sanitation. So it's not well seen here. Measles, I think we have seen people who are not getting vaccinated. We see those little outbreaks of measles and at different times. So the vaccines work. But, to think, oh, now everybody's got their COVID, or we have herd immunity, so COVID will be eliminated from the earth. No, it will always be there. Will always be out there. So we have to be vigilant about protecting ourselves.
And we just got a great question from one of our viewers asking, she is allergic to some antibiotics. Does that mean she might be allergic to the vaccine?
Well, you can go to the company's websites. You can go to the CDC website, and they have the exact formulations that are in there. There is no antibiotic in the vaccines. It's all chemicals. And when I read those, I thought, well, I have to see what those are, because, I have to know what, what's in there. Like, people know they're allergic to nuts. People know they're allergic to dairy. They know they're allergic to those they know they're allergic to antibiotics. Antibiotics are not in there, so that shouldn't be a problem. But what's in there are things like, and I tell you, I don't remember them, because they're things like dethylmyoxyl acetylcholine -14. It's like, who knows if they're allergic to that? But if you do have a lot of allergy problems, you might want to call your primary healthcare professional and ask them, will this be a problem for me? Because I don't know anybody on earth who knows chemical formulas and they're allergic to that particular chemical formula.
Very true, very true.
Yeah, so it's kind of like, with the mRNA ones, I don't have really the scientific knowledge about that, but I think that there's a less chance of an allergic reaction than with the traditional vaccine. We'll have to see how all of that goes. So talk to your primary care professional just to make sure, or if they think one is better than another. Right now, we're saying that the one that you don't take is the one that is the bad one. Just take one. Now, some people have ethical issues against taking the vaccine, and that's their business, and that's fine. When we get enough people vaccinated, there will be a herd immunity, so your chances will go down, but you want to be very cautious.
Another question around allergies that I know my mother has had, some of my friends have had, and I'm sure maybe this viewer with allergies has had. If you're someone who has extreme allergies, should you be concerned about where you're getting the vaccine? Would you want to go to the hospital or your primary care versus a pharmacy that might not, if you do have a reaction, might not be able to take care of you?
Well, I tell you, I was concerned about this for people who have spinal cord injury that would be going to one of these mass facs where you roll down your car window and they give it to you and off you go. So I did some investigating about that. Now, if you're going to have an allergic reaction, it's going to be within the first 15 minutes. So even if you go to those mass vaccinations where you pull up in your car, they then have you pull over to the side and they have a nurse that walks around. Are you okay? Are you okay? And you can get attention right away. I worry for people who are in wheelchairs that get in a van, are in lockdown in their van, they get their shot. And then if they get over to the side, and on the odd chance that they have something, maybe they're highly allergic to whatever, on the odd chance that they're in that waiting area, how are they going to get to you to help you breathe if you're in that van, in your lockdown, in your wheelchair, and you've got to get out of all of that, so I do worry about that for people who are have mobility issues. But since I found out that there's people monitoring that, I thought you would just drive up, get the shot, and go home. I didn't know, but they do have monitoring areas. Now, when I took my mom, we went to one of those mass vaccination centers in like a big ballroom. It was in a college, university, union center. And after she had her shot, then we went over for 15 minutes and there were emergency people there just at the ready for you. You just sat there, you didn't do anything, but they're observing you. So I was really comfortable with that. If you go to the pharmacy, they're going to call 911. You're going to have to wait till 911 comes. If you go to your healthcare provider's office, they're going to call 911. If you're able to go to a hospital, you might be in the conference center and not in the hospital per se. So they're going to call 911. So, now they will have, emergency respiratory equipment there, but some conference centers do and some conference centers don't. The interesting thing about the vaccine, I do like to point out about that is the vaccine's completely free. You will not pay for this vaccine. You've already paid for it in your taxes. However, if you go to the drugstore, if you go to a physician's office, if you go to the Costco now is giving them, there's contracts with Piggly Wiggly. If you have one of those, they're going to be giving them. They will charge an administration fee. So that's something to think about. If you go to the Department of Public Health to one of these mass vaccine, no bill. So if you're concerned about that, it might checker where you want to go to get that. But as far as safety, I think no matter where you go, you're going to have access to emergency care.
Well, I will say on that point, I would be remiss if I didn't point out that Help Hope Live can help you fundraise for any of your COVID-related expenses, should you have any, as well as any expenses that you may have on a daily basis related to your injury. So certainly check us out anyway at helphopelive.org for all of that and to get some more information about fundraising with us. But bringing it back a little bit, we did have someone ask, and we just had someone mention that they've heard of possibly extending the time between the two shots. Maybe that would help between the shot number 1 and shot number 2. I think there's normally a 2-week waiting period, 3-week waiting period, but some people
for the Pfizer shot, it's a 3-week waiting period, and for the Moderna, it's a 4-week waiting period. Now, the company manufacturers recommend that you get them on that schedule. You have a little window of time, 1 or 2 days. But like the reader that had written in here about their son's hematology doctor recommended a different time phase, then you follow what your doctor says. So, there's going to be caveats, but just for the general population, like everybody, it's going to be 3 weeks for the Pfizer and 4 weeks for the Moderna, unless your doctor says you need something different. And then certainly you want to do what they say.
Okay, so it looks like I may be having some audio issues, so I apologize for that. We are working on it, yes. So Linda, I will say just the last question that I'm going to have, and then I may have Emily feed you just another one, but people were wondering if you had heard anything about individuals with spinal cords contracting COVID and how that might.
Yes, I do not know anyone personally who's contracted COVID that has a spinal cord injury. But will somebody out there who has a spinal cord injury? Probably, just because it can happen to anybody. But the thing I'd like to point out is that having that neurological condition, maybe having problems with your immune system because of that, does put you at higher risk. But that doesn't necessarily mean that well, that's just, it's over. There are drugs, this monoclonal antibody. For myself, I don't have a spinal cord injury, but I am immunocompromised, and I have my whole family alerted. Should I get the COVID, ask for the monoclonal antibodies. Now, I'm not bringing politics into this, but regardless of your political view, remember President Trump got COVID and he had the monoclonal antibodies. They're very effective. They used to be an experimental, but now they're in, again, this emergency. So just about anywhere you go, you can have that treatment. There's also convalescent plasma that you can have. So ask for these treatments early. If you have to go to the hospital, say, I would like to know, can I have the convalescent plasma? Can I have the monoclonal antibodies? Be aggressive about your healthcare. Now, I have people on my TV almost every night, somebody who's like 100 years old with multiple risk factors, and they're celebrating because they're coming out of the hospital. They survived. So you can have all the risk factors in the world, and for some odd reason, you survive. we have people that go into the hospital and become very ill with the COVID, and they have no risk factors. They're young, they're healthy, they're out doing heavy kind of work, so they're physically fit, and they die. And so why do some people and why don't some people? Well, who knows? That's yet to be figured out. I suppose it's like any other disease. Why do some people die and some people don't? We just don't have the answers to that. But even though you have a number of risk factors, including spinal cord injury, does not mean that you're not going to survive this. It does not mean that you're necessarily even going to end up in the hospital. So, we just have to, we have to write it out and see. But my recommendation is, we know that there are some treatments, and those being two, the monoclonal antibodies and the convalescent plasma. If you become ill with the COVID, ask for them right away, because in some areas, they're going to be given to you no matter what. But in some areas, you're going to have to ask for that and be really aggressive in your care. So one thing I see that time is coming down. I want to know if anybody suggested anything about what they're doing during the COVID. I haven't seen anything go by. Have you seen anything, Sunny? Because I'm interested in what people are doing.
It's actually Emily here from Help Hope Live. I'm just hopping in while Sunny deals with her mic issues. So I haven't seen any great responses on that yet, but if anyone has thoughts on that, we'd love to see it in the chat. And we're happy to include that in our wrap-up blog post too. Same goes for any other questions that might be coming up for folks who are tuning in. If you do have a question that hasn't been answered yet, we have a couple more to get to. But if you have a question that's outstanding, please do feel free to drop it in the chat or send us an email. We'll make sure all those questions are addressed in our blog post, along with providing a recording of this Hope Talk. So I just have a few more to get to here.
And I see that somebody's learning to play chess. So what a great thing, because it's so stimulating for the mind. Something else I wanted to bring up, it's related to COVID, but it's a little bit different. And that is this whole issue that's happened down in Texas, where they had the sudden, the polar vortex, as most of us had across the country. But, their power grid, they lost power and everybody's cold, no water. So if you have a disability of any kind that affects your mobility, or if you are require some kind of electrical use, such as charging your wheelchair, use of a ventilator, please take the time to call, not 911, that's for emergencies, but to call your local firehouse or your local paramedic center and identify yourself to them. Because if they know that there's a person in their jurisdiction that has special needs, so say even if there's a fire in your house and you're using a wheelchair or using crutches, a walker, something to get around, and they know that you have that special need, they will come prepared to help you. If they know that the power is out and you have problems breathing, you need a ventilator, maybe use CPAP machine at night, they will do things to restore power to your house, to your street, to your area as quickly as they possibly can. So be sure and identify yourself to them if you have any kind of special needs at all. My husband had a spinal cord injury through medical causes. And because of the medical causes, he had a lot of speech problems. So when I would be at work, if he would need help, he had to call 911 for help. And they couldn't understand what he was saying. But once we identified himself, they'd be like, okay, Mr. Schultz, we're on our way. We're coming to help you, with whatever the problem was. And he didn't have to try to explain, what the issue was, what was going on. And they would just, boom, they would just be there at the house. So it's very helpful if you let people know what things are going on. So if there are any more questions, I do see a question about if you've had transverse myelitis or Guillain-Barré, should a particular vaccine not be used? So be sure and check with your healthcare provider about that, because those cases are all really individual. They might recommend one of the mRNA ones over the traditional vaccine, but that is really such an individual question. So I'm just gonna let your healthcare provider check if you have any question at all, especially with those transverse myelitis and Guillain-Barré. They're thought to be from a bacteria or a virus. So check to make sure, because, you know, we're talking about in the same vein of things. And then another one has, her mom has some allergies. Can she get vaccinated for COVID? Again, I would check with your healthcare provider on that, because depending on what the allergies are and how compromised they are, I will say, apropos of nothing, but just for educational information, the most compromised individuals in our society are those elderly individuals that are in long-term care. They're there because of a reason. They're there because they have issues. You know, if they didn't have issues, they wouldn't be there. So they're elderly, they have multiple healthcare problems, maybe from hypertension to diabetes to neurological issues, dementia, all kinds of things. And it can be just a variety of things. So, you know, check with your healthcare provider. And those people were vaccinated first, in particular, because they're so at risk. So the more compromised you are, the more at risk you are. So that makes it more important to get the vaccine, but check with your healthcare provider, because there are multiple things going on there. So, you know, some things just have to be found out for you as an individual. There really isn't a blanket policy for a lot of this. I see United Spinal, Vincent, or Jane is on there. I'm not sure. Anyway, United Spinal Association. I know that in Texas in particular, and I'm probably in all the United Spinal associations, they have emergency protocols for when there's disasters. So I know that United Spinal was very active when, I haven't heard about this polar vortex, but I'm sure they were very active because they did a lot of things during the terrible storms and floods down in the South, and did some wonderful work down there too. So things to think about. Any other questions that are coming in? Do you have any, Emily, or?
Yeah, I did have just one more that I'd love for us to cover before we start to wrap up for today. One question that was submitted to us before this Hope Talk was, are there any good resources for recovery models or exercises for recovering from COVID-19 for people who are living with paralysis?
We don't really know a lot of models yet that have come out about that, but people are working on that. Now, I do want to point out that the government has authorized that anybody who has COVID will get rehabilitation after their COVID episode for whatever residual deficits are left. So that would include people who have spinal cord injury. Now, I am seeing on the news where people are having a struggle getting that. If you have a spinal cord injury, we're all familiar with that. So we haven't seen yet what those models are. One of the issues is that everybody is affected a little bit differently. So some people have more neurological problems, some people have more respiratory problems, some people have more cardiovascular problems. Some people have had sepsis where it's traveled throughout their whole body, and there's issues with circulation. Maybe they've had to have amputations. So everybody is still a little bit different yet. So all of that is being sorted out, but we will be seeing some models for therapy that will be coming out as time goes by. Certainly for spinal cord injury, keeping the respiratory system as healthy as possible is going to be important. Adding activity is always important. You know, the area of your body below the spinal cord injury is not getting that stimulation from the nervous system. So you can supply that even by passively moving your arms and legs below the level of injury. So that's going to be important. So with that, I see we're at the top of the hour. And
yes, we are, which I think that everyone probably agrees that time really did fly by today. And that's just a tribute to your expertise on this subject. It's been a real pleasure having you here. I'm just so happy that we could take this time to discuss these topics, which have been on so many people's minds, especially for folks who are affected by paralysis and for their families and caregivers. I just want to remind everybody who's tuning in that we will have a recording of this Hope Talk. It'll be on YouTube. It'll also be emailed to you directly if you registered in advance. So if you're here right now, no worries. If you missed any of this Hope Talk, we'll be happy to automatically just email you a YouTube link so you can see the whole thing. You don't want to miss it. If you did have any questions that weren't answered today, whether you posted them in the chat or whether they're just occurring to you now, please do feel free to send them in to us when you get that email. We would love to include them in our blog post recap. Beyond that, I just want to remind you that we're bringing this presentation to you today from Help Hope Live, which is a medical fundraising nonprofit. What we do is just to put care and equipment within reach for individuals who are living with paralysis or other critical medical events. So if you do need any assistance with fundraising or with the financial side of life with paralysis, we'd love to help. You can find us at helphopelive.org. It's also really important to us to bring resources to you that keep you informed, keep you connected to your community, especially during a time of pandemic, which has been so disruptive for all of us. So we're so glad that we could be joined by such an expert on the topic today. We hope all of you will stay well, and thank you so much for bringing your expertise to us today. We've really enjoyed it.
And thank you for having me.
It's been a pleasure, guys. So that's going to wrap it up for us today, and look out for that email recording if you missed anything. And we hope to see you for our next Hope Talk. Thank you for your time, everyone.
Emily?